Hello ladies, welcome back to my Menopause Barbie apartment. We haven't been here for a while, so it's nice to be back. We've been out on a bunch of field trips doing interviews. I've taken you on multiple visits to various healthcare providers in areas where I'm not an expert. And I even took you to one provider, one professional where I am an expert, but I just wanted you to hear it from someone else. You see, I think it's been quite an education, and I know I've learned a lot, so I hope you have too. So I want to take this opportunity today to kind of begin putting it all into perspective for you. This material's not in the book or the outline notes, but at the end I'll have a written summary for you, as you know. You know, those interviews are great, but sometimes you can get bogged down in the details during a particular interview, or sometimes you kind of get sidetracked by the particular individual that I'm interviewing. And since these videos reach women all over the world, most of you aren't going to be seeking out the individuals that I interviewed specifically. You're going to be looking for similar professionals in your part of the world. So even if you watched each of those individual interviews, stay tuned to this one. Let me tell you where we're going with all this. This video and the two that follow it are a unit, but I'm dividing them up into 3 different videos because it's just too much material for one single video. But together, they constitute a summary of all the professionals you can use to manage your menopause. You think it doesn't really matter which kind of professional you use? Well, think again. It makes a huge difference. So I'll help you compare and contrast some of the differences between the different professionals available for menopause management, or maybe we should call it minnow management. You see, that way, if you decide to manage your menopause using one of these professionals or a certain technique, it'll be a whole lot easier for you to seek out just the right professional for managing your menopause your way. See, some of you have relayed very awkward, inconvenient, or frustrating experiences with various professionals to me in the comments section of the videos. And you know, that's made me realize that most people don't know what to expect from various professionals. So my goal is to help you find the right kind of professional for your goals. And so I'm taking this time to point out the differences that can affect how effectively each professional can help you manage your menopause your way. I don't want you to be dissatisfied with your menopause management, I mean your minnow management, simply because you went to the wrong professional. So these 3 videos will keep you from wasting a whole lot of time looking for help in all the wrong places. So in this video today, I'm going to present the professionals in the traditional medical arena. And in the next one, I'll cover the hybrid professionals who kind of hover in between the medical and alternative and complementary arenas. And then in the next one after that, I'll cover the professionals that are strictly in the alternative and complementary arena. And I'll give you all the details so that you'll know what to expect from each of the different kinds of professionals. And no matter what the specialty or the profession, always remember one thing. There are people who take an active interest in the topic of menopause, and there are others who don't. So don't judge an entire profession by an experience with just one professional. As with anything, passion is priceless. If you find someone in any of these professions who's passionate about menopause, you know, like I am, you'll have a much better experience than you will with someone who's kind of ho-hum about it. So let's go through these medical practitioners one by one. Now, although I've never worn it much in the past, I wore my doctor's coat for you today since we're talking about medical doctors. And well, I'm a doctor, so that's why I wore it. Back when I was practicing OB-GYN, I actually dressed just like I do for these videos. It's my normal attire. Obviously I never really fit in, but I think you've already guessed that, haven't you? Well, we had a monthly staff meeting early on the first Monday of each month. And see, this was always in a conference room at the hospital with a great big circular arrangement of those long rectangular tables, and all of the OB-GYN doctors would come to the meeting. And as you can imagine, the physicians consisted of a bunch of balding elderly men in scrubs and white lab coats, along with a few female physicians who dressed pretty much like the men. And then there was me. Yeah, then there was me. Well, one morning I came into the room wearing my typical lacy dress, some garment. And the chairman of the department was Raymond Kaufman, who was this world-renowned, fantastic, wonderful man. And he's sitting at the head of the table. And as I walked into the room, he turned to me and he said, "Dr. Taylor, what are you running? A gynecology practice or a fashion show?" And I stopped and looked at him and kind of said, well, I think it's a little bit of both. And one of the female physicians looked up and said, "Heck, the only reason I even come to these meetings is to see what she'll be wearing." Yeah, like I said, I never really fit in. Anyway, okay, let's start with the gynecologists like myself. Now, all gynecologists are doctors who have completed 4 years of medical school and 4 years of residency training specifically in obstetrics and gynecology. So these physicians have spent 4 years of training, and we're talking about work weeks of about 120 hours a week, day in and day out, focusing on nothing but women's health. Now that's going to be important for reasons that will become apparent to you in a little bit. Now you might think that all gynecologists have the same expertise or that they all treat similar volumes of menopausal patients. But that is not the case. There are actually 3 categories of gynecologists who provide services for menopause management. And so what I'm going to do is I'm going to present each one and compare them for you. Okay, so at the very, very top of the heap of all the specialists that can help you manage your menopause are the Gynecologic Menopause Specialists. These are gynecologists who specialize in nothing but menopause. That means their entire practice consists of nothing but women dealing with menopause. So you're going to have this, and this, and this, and this, and this. You're going to have nothing but women who are in the age range of menopause. So in other words, menopause is their life. They eat, drink, and breathe menopause. It's their passion. By far, they are the most educated about menopause. You see, I fall into this group. And for us, making life better for menopausal women is our greatest goal. And of course, we're educated in traditional medicine, and the philosophy of traditional medicine is to treat menopause by replacing what's lost, which is hormones. So the idea behind traditional medicine for these specialists is give hormones to replace what's lost. Now, if you think about it, menopause is actually a hormone deficiency, just like any other hormone deficiency. And when you're deficient in a hormone, whether it's insulin or thyroid hormone or estrogen, replacing it is going to restore your body to its optimal level of functioning. So that's the philosophy. So the primary tools for gynecologic menopause specialists are hormones. They may be synthetic, they may be bioidentical, but hormones and lifestyle and dietary changes are basically what they're going to use as measures for treating your symptoms. And we talked about all the hormones. There's everything. There's all kinds of hormones that you can use for treating menopause. And whether you're using any of these synthetic items that I have shown you, all of these on a few different occasions, or whether you're using a bioidentical type of hormones, the whole idea is still going to be hormone replacement to replace the deficient hormone. Now, how effective are these hormone options? Well, of all the options, hormones are definitely going to be the most effective. But there's a great irony in this area. One of the major focuses for gynecologic menopause specialists that isn't nearly as important to other professionals that I'll be presenting to you is the long-term consequences of menopause and how you manage it. What this means is that the gynecologic menopause specialist is considering your long-term health risks that are affected by how you manage your menopause. So what are these risks? Well, these risks include heart attack, osteoporosis, breast cancer, uterine cancer, ovarian cancer, and Alzheimer's disease. And it turns out that it takes a thorough education in menopause to understand and balance all of these factors if you care about the long term. And hormone therapy is the most guaranteed way of managing both the short-term symptoms and the long-term health risks associated with menopause. But here's the irony. Most women have been scared to the point of fearing the very thing that will help them live the longest, which is hormones. And the majority of women focus only on the short-term symptoms of menopause, like the hot flashes. So you've already seen how some professionals talk mostly about the hot flashes. Okay, so most women are focused on the hot flashes. So what you have now is a menopause specialist who can really cover all the bases, but a population of women who are afraid to take advantage of the services that those professionals have to offer. Now, okay, I admit that the majority of MDs aren't that warm and fuzzy, right? Okay. And there's more to managing your menopause than just having the most sophisticated professional or the highest degree of medications. But do not expect your gynecologic menopause specialist to be very familiar with the herbs, the acupuncture, or the hypnosis for menopause management. They may or may not be comfortable with even the compounded bioidentical hormones. They might be married to the idea of sticking with the pharmaceutical options. So I totally get it if you don't want to work with a gynecologic menopause specialist, but you need to know that they exist. A lot of women don't know that they exist. Okay, and so here's how you can find one if you live in North America. There's an organization called the North American Menopause Society, or NAMS. And the website for North American Menopause Society is menopause.org. So go to menopause.org. And just under the blue banner, in the middle of that blue banner on the top, click on the tab that says For Women. And then click on the very first item, which is Find a Menopause Practitioner. See, these are all gynecologic menopause specialists in active practice. And all you have to do then is put in your zip code, and voila, it'll show you all the menopause specialists in your area. Now, in addition to being menopause specialists, these are all NAMS certified menopause practitioners, which means that they've passed an exam on menopause management specifically. So, if you want to manage your menopause using the highest level of expertise, professional, in the traditional medicine world, and you're focused on the long-term health risks of menopause and aging, this might be the best kind of professional for you. You see, I'm a member of this organization, but I'm not going to be listed because I'm not practicing medicine. Instead, I'm teaching you. Remember, doctors in active practice don't have time to teach you all this stuff in a 10-minute office visit. That's why you have me. And speaking of having time to teach you, I give a 2-day menopause seminar each quarter. It's a knock your socks off event that teaches you everything you need to know in just 2 days. 2 days of education compared to the 10 minutes you get in an office visit. Ladies, you can't learn what you need to know in less than 2 days. I guarantee it. And today, I'm giving away one seminar. This is a huge gift. Make sure you enter this giveaway. Just go to my website, menopausetailor.me, to register. And we'll leave this entry form open for 1 week. It will end at 12:01 a.m. Central Time on July 18th, 2017. I am the only person on planet Earth providing an education like this. Please take advantage of it. This seminar is the best investment you could ever make in yourself and your future. And we'll notify you if you're the winner. And if you don't win, sign up for a menopause seminar anyway. You'll need it whether you win or not, or whether it's free or not. Okay, so back to the professionals. Okay, so after the gynecologic menopause specialist, we have the general gynecologist, who does only gynecology and no obstetrics. Now, these are doctors who are very well educated about menopause, and they treat a lot of women for it. But they don't limit their practices to just menopause. So they see women for all the various female health issues outside of pregnancy. They're going to see women who are young and older and young and middle-aged, older. They're going to see women in all kinds of categories. You're going to see a bunch of different aged women in their waiting rooms. And of course, being gynecologists, they're also trained in traditional medicine. So most things about them are going to be the same as what I told you about the gynecologic menopause specialists. And their knowledge, the knowledge of the general gynecologist may be equal to that of the gynecologic menopause specialist. They just don't have practices exclusive to menopause. So they're passionate about a lot of other female health issues besides menopause. Now, the general gynecologists are going to be much more numerous and much easier to find than the ones who focus exclusively on menopause. And they can take care of all your symptoms of menopause. They can help you prevent the long-term diseases that I enumerated earlier. Do you remember what they were? Just in case you forgot. Heart attack, osteoporosis, breast cancer, uterine cancer, ovarian cancer, and Alzheimer's disease. And the general gynecologist is like the menopause specialist in that their primary tool is going to be hormones. Whether they're pharmaceutical or bioidentical, hormones are going to be the primary tool. The philosophy is the same. Menopause is a state of estrogen deficiency. And so when you have a deficiency, you replace the item that's deficient, in this case, estrogen. Now, they also are not going to know about the alternative and complementary options. That's just not part of the education for traditional medical physicians. And they may or may not be hot on the idea of compounded bioidentical hormones. That's going to depend on the individual. But if you're interested in avoiding the long-term health risks of menopause, and you want someone who is specifically trained in menopause management, but you don't really need a specialist and you do want to take hormones, a general gynecologist might be the professional for you. So next, we have the obstetrician gynecologist. Now, this is the same kind of professional, but these people divide their time between pregnant women and non-pregnant women. You know what obstetricians are, don't you? You see this plaque? Can you see what's written right under the exam table? A patient gave me this. I used to always say this. Obstetricians, I used to say, we're people pulling people out of people. So she gave me this plaque that says, people pulling people out of people. Anyway, it's kind of fun. So obstetricians are doctors who deliver babies. And they have the same expertise as the other two categories of gynecologists, and their philosophy of menopause is the same. It's the same thought of it being a hormone deficient state, and they're going to use hormones to replace and manage it. The big difference is that they still deliver babies. And that can put a damper on the time they can spend with you. Or they may just not find managing menopause as much fun as delivering babies. So this is a picture of my days of practicing obstetrics. It's a picture of me and one of my babies that I delivered. And here, God, I have a bunch of albums, but here is an album full of pictures of babies I delivered, because patients always give you pictures of them and their babies, twins I delivered with bibs that I gave them. There's always a picture. And so I have album after album after album of baby pictures. Here's a bunch of others, more albums. I have a bunch more. So doing obstetrics is really fun. For some doctors, menopause isn't as fun. So in the obstetrician gynecologist waiting room, you're going to see older women, you're going to see pregnant women, you're going to see middle-aged women, you're going to see older women, you're going to see pregnant women, you're going to see young women, you're going to see pregnant women. Okay, you're going to see all kinds of things, okay? But obstetrician gynecologists are still going to know everything about preventing the long-term diseases of menopause, such as heart attack, osteoporosis, breast cancer, uterine cancer, ovarian cancer, and Alzheimer's disease. Are you getting the feeling that I'm trying to pound into your head the fact that there are long-term diseases that are consequences of how you manage your menopause? I hope you're getting that idea. It's not just about hot flashes. Big, huge problem with the mentality of menopause these days. Everyone's talking about hot flashes. It's about so much more than that. Now, these obstetrician gynecologists also know how to help you alleviate all your symptoms of menopause, just like the other two categories of gynecologists. And just like the other two categories, they're not going to know about the alternative and complementary options. It's not their thing. So let's say you still go to the obstetrician gynecologist who delivered your children, and you feel like that person knows you very well. Maybe you want to stick with that person to help you manage your menopause. In general, it's about being sure you know what you can expect from the different categories of gynecologists. So there you have the three categories: the Gynecologic Menopause Specialist, the General Gynecologist, and the Obstetrician Gynecologist. Three categories of gynecologists alone. Now, by far, these are the professionals most suited and most educated to help you manage your menopause your way if you're interested in traditional medicine. Okay, so next, inside this same traditional medicine category, we have internal medicine doctors. Now, these are doctors trained in traditional medicine who focus on chronic disease. So they're experts on diseases in all parts of the body, male and female. But they only take care of adults, no kids. So in an internal medicine doctor's office, you're going to see women and men, older women. You're going to see middle-aged men, young men, middle-aged men, women, old men. You're going to see a lot of different kinds of folks, but they're all going to be adults, okay? And most internal medicine doctors do some gynecology, even though they're not really trained specifically to do so. You know, in medical school, I think doctors in general in training, we only get about an hour on the topic of menopause in medical school. I'm not kidding you, an hour. When I sit around and talk about medical school with my colleagues, when we reflect on how much did we learn about menopause in medical school, it's about an hour. Some of us don't remember any of it. So doctors do not get much education or training on menopause matters at all in medical school. That means that if they don't go into a specialty that involves gynecology, they're likely to never get any real education on menopause. It's kind of just lumped in together with women's health, and it's like, okay, menopause comes about, you stop being reproductive, and that's pretty much all they say. Now granted, menopause is not the most complicated subject on the block, and it isn't even a disease. But when you're the woman suffering through it, you might want a real expert helping you to manage it. So internal medicine doctors share this philosophy of menopause as a state of hormone deficiency, and they also manage it by replacing the hormones. But their repertoire of options for you will be more limited than that of any of the gynecologists. I mean, hey, they have to know all sorts of things to take care of all these other people, okay? They aren't only thinking about menopause. So they're not going to know as much about menopause. Okay, understand? So hopefully an internal medicine doctor will know about the need to balance estrogen and progesterone to protect your uterus from uterine cancer, but not always. Sometimes that's not quite part of what they're thinking about. And if you need adjustments and modifications and anything more than the basics, you might need to go to a gynecologist. They might refer you to a gynecologist. I would say that most internal medicine doctors should know the basics, but they may not know much more than that. You know, if your internist says, take this, it's what I give all my menopausal patients, that should be a red flag. It's not a red flag that it's a bad doctor at all. It's just a flag that tells you that there are limitations. And those limitations in a doctor's education will have to limit your expectations, okay? So internists are even less likely than any of the gynecologists to give you compounded bioidentical hormones. They may not even be familiar with them. And typically they're not going to be fans of the alternative and complementary anything. Okay, and they may or may not even know about the effect of hormones in preventing those long-term health risks of menopause. Okay, and that's kind of ironic given the fact that they do specialize in chronic diseases, but that's just the truth. Okay, so if you don't have a gynecologist and you feel comfortable managing your menopause with a generalist, and you want to use hormones and the traditional medical options, this might work for you. But if you're looking for someone who is up to date on all the latest management options and eager to really fine-tune all your menopausal woes, an internal medicine doctor is probably not going to be your best bet unless it's just someone who just loves menopause and has really, really studied it. Okay? Now, after the internal medicine doctor, we have the family practitioner or general practitioner. Now, this is also a traditional medical doctor who takes care of acute and minor problems as opposed to the chronic problems that the internal medicine doctor took care of. And these guys take care of the whole family. I mean, you're gonna have grandpa, you're gonna have grandma, you might have pregnant women, you're going to have kids, you're going to have young men, you're going to have teenagers, you're going to have guys, you're going to have everybody. They're going to take care of everything. They may even take care of some babies. So these people take care of a lot of different age groups, demographics. They're going to be tinkers of all trades, if you will. They know a lot of stuff, but they don't know it in the same depth all the time as the specialists do. So they focus less on the long-term chronic diseases and more on short-term minor diseases like, colds and flus and rashes and asthma, and those things are really important, but we're talking menopause here, okay? And their training in menopause is limited to what they got in medical school, an hour, all right? Their philosophy is going to be the same as that as internal medicine doctors and the gynecologists. Replace the deficient hormone. And they're going to be on board with the same types of tools, pharmaceutical hormones, bioidentical hormones, but rarely are they going to be fans of compounded bioidentical hormones. Remember also, you remember that I taught you that all bioidentical hormones are not compounded, right? Okay? Like the other traditional medicine physicians, the family practitioners are probably not going to be that fond of the alternative and complementary options. And like the internal medicine physicians, the family practitioners or general practitioners' knowledge about reducing your risks of long-term diseases will vary depending on their level of expertise in menopause. Generally speaking, an internal medicine physician is likely to know more than a family practitioner about the long-term risks simply because they deal more with long-term disease processes in general, and they deal more with adults in particular. And generally, neither the internal medicine docs nor the family practice docs are going to be as up to date with all of the options for managing your menopause as any of the gynecologists. I mean, they just work in different areas, right? But let's say you live in a small town. Well, the family practitioner or the general practitioner may be the most knowledgeable professional available to you in the traditional medical arena, okay? So what you've seen today is a range of professionals from the most specialized to the least specialized, but all in the traditional medical camp. And please note that there are nurse practitioners and physician's assistants in all of these areas. And most nurse practitioners and definitely physician's assistants work alongside physicians, and they share some of the same philosophies and limitations and tools as the physician with whom they work. And they may have less training than a physician, but they often have more time to spend with you. And everyone's going to have limitations. Every professional out there has limitations, and never hesitate to ask any professional about his or her level of expertise with menopause. I mean, you have a right to know the level of expertise and the limitations. Now, I have prepared a chart for you that depicts all these professionals that we've discussed today. And then there's another chart that actually combines all these professionals today with the professionals that I'll be presenting in the next 2 videos, and that way you can see where we're going. You'll find the chart for today and the expanded chart for these 3 videos in the descriptive portion of this video and on my website, which is menopausetailor.me. So here's the chart summarizing the material from today. Now, don't worry, you'll be able to read it on paper much more easily than you can on this screen. I am not trying to play some mean menopausal poor eyesight trick on you. This is the traditional medicine portion of the chart. In the first row, I've listed all the different professionals from the Gynecologic Menopause Specialist all the way to the family or general practitioner, and they're listed in order of expertise with menopause. The second row lists the focus that each one uses for approaching the topic of menopause. And in this case, they're all the same focus. The third row delineates the means or the tools that each one will use for treatment, which in this case is going to be the same. Okay, they're all in the traditional medical world. Their focus is hormone deficiency, and they're all going to be using hormones. The fourth row is the philosophy, which again is the same for all of them. And the fifth row lists the menopausal symptoms that are alleviated by the treatment that they have to offer. And the sixth row addresses the attention that I talked to you about reducing the long-term risks of the diseases associated with menopause. You know, the ones that I said I was trying to pound into your head. And on my website, but too big to show here, you'll see the chart with today's professionals along with the professionals that we'll be discussing in the next 2 videos. So, you know, in summary, expectation plays a huge role in menopause management. You have to know what you can expect from different professionals. And there are no professionals who are right or wrong, good or bad, better or worse. That's not what this is about. This is about setting up your expectations so that you know where to go and how to find what you want for your menopause management. My goal is just to tell you these differences so that you can find the kind of professional that will work best for you. Okay, I'm just here to help you with that. You see, I believe that you should shop for a doctor. You should go shopping for a doctor. It's like choosing a husband. The person you choose to help you manage your menopause needs to be someone you love. Don't settle for someone who has a ho-hum attitude about menopause. And don't work with someone who frustrates you. You know, when someone puts you in an adversarial position, that's not the way it's supposed to be. You need to find someone who functions as your advocate and works with you, not against you. So shop until you fall in love with a menopause manager. Okay, that's the case whether you choose to work within the traditional medical field or someone in the alternative and complementary area or someone in between. So this is where we'll pick up the next time with the hybrid professionals who kind of function in both alternative and complementary and traditional medical worlds. So don't forget to go to menopausetailor.me, sign up for the seminar giveaway, and if you don't win, sign up for a seminar anyway, okay? And don't forget to follow me on Facebook and Twitter and Instagram. Okay, I'm signing off for now. Until I see you in a week, bye.